All right, future leaders of the emergency department, you picked a field that's all about high stakes and even higher pressure. But here's the thing. The biggest challenge isn't always just treating the patients. It's managing the entire chaotic environment. So let's dive into the framework that's going to help you lead with confidence, even when it feels like everything is going sideways.
I want you to picture the most chaotic code you've ever seen. You know the one. Multiple things happening at once, a whirlwind of activity, and critical decisions being made every single second. How do you, as the person in charge, bring order to all that? That's really the big question we're tackling today.
And look, the answer isn't about just being the loudest person in the room or hoping you have good instincts. Nope. Real effective leadership in the ER is built on a structured, deliberate process. And the best part? It's a skill that you can absolutely learn and master. That whole process is built around what we call the 5 core functions of management. Seriously, think of this as your playbook. These are the fundamental strategies you're going to use to handle pretty much any situation the ER can throw at you.
So here they are. First, you've got planning. That's where you set your vision. Then comes organizing, where you build the whole system to make it happen. Staffing, of course, is getting the right people on your team. Directing is all about leading and motivating that team. And finally, controlling, which is just a fancy word for checking your results and making sure you're delivering quality care.
Now, we could spend a whole semester on each of these, but for right now, we're going to zero in on the first 2. Why? Because without solid planning and organizing, the other 3 just don't work. These 2 are the absolute bedrock of everything else you'll do as a leader.
Okay, so let's kick things off with planning. This is really where leadership begins. And it's not just about, making the weekly schedule. It's about creating the strategic blueprint for your entire unit's success.
So the key phrase on this slide is in advance. That's what this is all about. Planning is proactive, not reactive. It's the deep thinking work you do before the crisis hits, figuring out, okay, where are we trying to go, and what's the exact path to get there?
And here's the bottom line. You can't organize a team if you don't have a plan for what they're supposed to be doing. You can't figure out staffing if you haven't planned for your patient census. Literally every other management action you take flows directly from how good your initial plan is.
And this shows you that planning isn't just one thing you do. It's a whole process. First, you've got preparing. That's just gathering all your data. Patient trends, staffing numbers, supply usage, you name it. Then comes approval, where you get the buy-in. After that, you've got implementing. Time to put it into action. And then, the step everyone forgets, follow-up and evaluation, where you actually see if it worked and fix what didn't. It's a constant loop.
A really effective plan isn't just some document that sits on a shelf. It has to be holistic. It involves everybody. It's got to be realistic. You can't plan for 5 new trauma bays if you only have the budget for 1. And this one is so important in the ER, it has to be flexible. Things change in a heartbeat, and your plan needs to be able to bend without totally breaking.
So once you have that brilliant plan, how do you actually put all the pieces together to make it real? Well, that brings us right to our second core function, organizing. Think about it like this. You've done all the hard strategic work. You have your blueprint. But a blueprint is just paper, right? How do you turn that piece of paper into a smooth-running, efficient ER? How do you get the right people, the right equipment, and the right processes all working together? That's what organizing is all about. It's the logical step of setting up the formal structure of your unit. Who's the go-to trauma nurse? Who's covering triage? Who reports to who during a code? Organizing answers all of those questions. It's about defining roles and setting up workflows so your team can actually execute the amazing plan you came up with.
And this stuff isn't just theory. As a manager, organizing comes down to simple, practical, everyday actions. Are the crash carts stocked before the shift starts so a nurse isn't scrambling for a central line kit mid-code? Does every nurse have a clear assignment and a minute to breathe and plan their care? Are you actually checking in to see if the system is working, or are you just assuming it is? This is where the rubber meets the road, and getting these details right is what separates a good manager from a truly great leader.
Okay, so let's bring this all home and talk about what this really means for you, right now, as you get ready to step into a leadership role in one of the toughest environments in all of healthcare.
It's really easy to hear words like planning and organizing and think, oh, that's just business school jargon. It's not. In the ER, a solid plan can be the difference between a smooth trauma response and a chaotic mess. A well-organized team means better patient outcomes and way less burnout for your staff. These are your real-world tools.
And the framework we've been talking about, this isn't something we just made up. It's a core part of management training for ER nurses, grounded in established curricula like the one from the Khan Yunis Training Center. This is proven foundational stuff for anyone who's serious about leading in this field.
So if there's one thing you take away, it's this. Your clinical skills are what got you to this point, but they aren't enough to make you a great manager. It's your ability to step back, to plan strategically, and to organize your team effectively that will define your success as a leader. That's the big transition you're getting ready to make.
See, it's about more than just knowing this stuff. It's about a total shift in your mindset, from doing all the work yourself to empowering an entire team to do their work exceptionally well. And the question you have to ask yourself now is, are you ready to take that step?